Hi everyone, welcome to the International Youth Neuroscience Association INA channel. Today, we're extremely honored to talk to Dr. Gary Lau. Dr. Lau is an accomplished neurologist and professor, working at Queen Mary Hospital and the University of Hong Kong. He also holds many leadership roles, such as the Assistant Dean of Education Innovations at the Li Ka-shing Faculty of Medicine and the Director of HKU Stoke. With prestigious awards like the HK 10 Young Outstanding Persons, he is a role model of passion and excellence. We are so grateful for Dr. Lau's time and interview today. Dr. Lau, why did you choose a career in neurology, and did your upbringing shape your decisions?
That really boils down to a few aspects, right? One is your own personality, your skill set, right? So I'm not very skilled with my hands, right? So I can never be a surgeon. But it really was when I started my residency, right, in internal medicine. My first post was in rehabilitation medicine. I saw a lot of patients with different neurological conditions, right? Patients with strokes, with Parkinson's, dementias, and so on. That's when I felt that neurology was the right specialty. So I really liked the mix, right, of the conditions, right? The fact that we do need to provide holistic care, not just treating one physically, right, but the psychosocial well-being is very important, right? The challenges related to neurology, right? We often the time need to think about where the problem is, right? Because the brain is a very complicated organ, right? But what may be happening wrong, right? But also a lot of opportunities for research as well, right? As you know, neuroscience is a evolving area, right? Lots of opportunities and challenges. So that's how I got into neurology. So I first started teaching back in 2011, so for quite a few years now. And I got into teaching because I felt that as a doctor, even if I was very hardworking, at most the number of patients I can see every day would be 30, 40, right, or so. But I felt that if I went into teaching, right, then if I was able to teach 10 students, 100 students or more, right, even if a small proportion, right, was perhaps inspired by my sort of values or things that I felt was important, right, hopefully they would take these into mind and hopefully sort of go and do other things that would be sort of helpful for the society as well. So I feel that's why I went into education in the first place, right? So if I can empower and inspire, right, the younger generation, they can help make the society a better place.
Well, that seems very interesting, and judging by what you said just now, I guess it wasn't entirely a straightforward decision or a straightforward path. As many people know, like career paths sometimes take twists and turns, but in the end you still move forward. So that's really great to hear. Knowing that you're a Christian, has faith influenced the way that you work, maybe like in your career or research? And like, do you think that it's important?
We all go through different hardships at different stages of our life. But I think faith is important because you realize that we learn a lot from our mistakes and from things that we have done in the past. I also realize actually how small or sort of minute we are in the grand scheme of things, right? And hence, I think that's important because then we realize we're only part of a small piece of the picture, because often at time we sort of think in silos, right, and what I can do, right, and to benefit a small proportion or sort of small group of people. But if we think broader and grander, actually we can achieve much greater things as well. So I think that's quite important too.
Maybe sometimes you have to carry out difficult conversations with patients or their families. So how do you manage emotions and communication effectively?
Yeah, I think I always teach our students it's important to step into others' shoes, right? In Chinese, 逆地而處. As a patient, right, as a carer, if they're receiving this sort of news, right, it may be not very pleasing news or bad news, right? How would one like to receive it? Over time, it's always important to self-reflect, right? Over time, can I do things better, right? Have I done things, are there things that if I'm looking back, can there be things that I can do differently, right? I think that's also very important as well. So I think understanding we have our limitations, we should try our best, but we're also not alone, right? We also involve other colleagues, right? For example, we have therapists, we have social workers, we have clinical psychologists, right, who are all there to help support our patients. So
what's the most challenging part of your career?
I remember seeing a patient recently with a really bad bleed in the brain, right? He's only about 40, but he passed away within 2 days of being admitted. His wife, he has a 2-year-old child. It is challenging, right, to discuss these with family, relatives, but I think it also gives us a drive to see what we can do better, right, in terms of its prevention, in terms of research into how we can prevent these conditions, treatments, and so on.
A lot of the times patients, again, might not have expected outcomes. Like, do you think sometimes it'll become like, it'll seem like a personal like failure or a personal attack of it, like you tried everything and it still didn't work? Like, would it like really bother you, and how would you deal with that stress?
I think we just have to accept our limitations, right? We have to, of course, we do feel unhappy. We do have our emotions, right? We do need to learn how to deal with them. But it's also important for us to know that when to move on, and don't let these negative thoughts or emotions override everything else, right? So I think we also need to know how to deal with it, and also keep moving forward.
What would be your most memorable or insightful patient experience, and what did you learn from it?
I think the most memorable case was really someone in the mid-40s with motor neuron disease, or ALS, amyotrophic lateral sclerosis. And basically, he has been lying in bed. ALS, motor neuron disease, is a neurodegenerative condition. Basically, over time, people lose control of the muscles of the body. Right? They gradually, right, they may become bedbound. Right? They also lose ability to, for example, to swallow, to speak, and also to breathe. So when I was seeing this patient, he was already lying in bed for a number of months already. He had a tracheostomy, right, over the neck to help him breathe, right. So he was connected to a machine. He had a tube, right, nasogastric tube to help with feeding. And it was memorable because, first of all, it realized how blessed we are, right? Because things we take for granted, right? From moving our bodies, right, to eating, to swallowing, to breathing, right? Actually, there are patients or people out there who do not have these blessings.
I think that's really great, and I also really agree with you on like the gratefulness part. Like, I guess a lot of the times when I'm really healthy, I don't really think much, and I worry about other things instead. When I'm sick and I feel like I have limitations, and I realize, oh wow, like I took all these things for granted, and I like just stop complaining about everything. I think that's something that medicine or sickness like really shows me as well.
That's right.
Recently, we also know that you've built health apps such as WeRise or other platforms. So what first drew you to software development, and what is your view on like AI and technology in this generation?
So I was interested in software development because I felt that, yes, of course, mobile phones or technology, I mean, it's very accessible these days. But the goal really was to see of the WeRise platform was how we can condense a lot of information or materials or sort of functions, right, using devices that could help our patients. And often at time, right, patients, carers, but we were looking for various support, right, information, okay, what is happening, how can I get better, right, I want to look for this information, that information, and so on, right? So I think the goal really was to see how we can consolidate, right, information into one package. Again, technology is only a tool which we use to help facilitate our patients, be it the diagnosis, the treatment, and the management. But I think it's very important that whilst we embrace the technology, the humanistic side of things is very important, the social interactions, right? I think easily, right, we can have done this interview through Zoom, right, or electronically. We can in the future, I mean, people may be doing messaging, chatbots, and so on, right? But with healthcare, right, I think especially the humanistic interactions extremely important. Again, right, earlier in the interview I shared, okay, step into the other shoes, and just imagine yourself, right, many years down the road, right, if you're seeing a doctor, right, for a particular illness, right, how would you like to be managed? Would you like to be cared by a humanoid robot, right, by a chatbot, right? Or would you like to have a physical interaction, right, with a doctor, right? I think whilst, yes, there are things that AI can do, right, but things that AI cannot replace, right, is, for example, love, compassion. These are key characteristics which healthcare professionals are equipped with, right? I mean, hence, I don't think any AI system, right, regardless how advanced, right, can replace